present. And so also easier at the office is working on the patient. Maybe it's going to pop in during this live. But as Dan was asking to present myself, I'm like 38 years young, and I work in Italy, in Modena. I graduated 2007, so I'm like already 13 years that I'm been practicing, and I always practiced with my brother, so which is basically my main mentor. And then after that, I did like just 2 years in New York at NYU for my postgraduate student, for my PhD. Sorry. And that's it. We work a lot on digital dentistry. We believe a lot on digital dentistry. So since I came back in 2011 from New York, we have tried to engage as much as possible with the intraoral scanning, with CAD/CAM technologies, and this is what became our main passion more than everything else. But of course, perio, pros, implant dentistry, this is what we do on the daily basis.
Okay, everybody know you were very affected in this period about this pandemic, COVID. Please tell me a few words. How was in Italy? You are the second invitation from Modena. First one was Maffei, Simone. And
our great friend, our great friend, Simone.
And Simone, and I know you are locked down like everybody. Please tell me if you was affected, how was it, and what are you doing? What are you doing this period?
Yes, we were locked down, and probably we were the first to be locked down, and it was strange because everybody had a busy schedule, a busy routine that we were used to it. Us in the clinic, my family, everybody was like having his routine. My child as well was having his routine to the kindergarten, and so it was strange because at the beginning was like nobody knew what was going to happen, and so it was a little bit also of panic because we were trying to figuring what scenario possibly could have happened, and we didn't know, and we were always looking at the TV trying to understand how many new positive patients were on coronavirus, and so it was kind of a stress beginning, let's say like this, because after the beginning we tried to tie everything up. We tried to stay positive both with the family and also with our work, because with our team we team build a lot utilizing platforms such as Zoom, which is the one that we're utilizing right now to communicate, to try to understand what to change, how to change in better for the reopening, because we immediately focus on the reopening. We didn't know when, but we said when we reopen again, we should improve this. We should change our biosafety mindset, for example, as well. So we should do new protocols. We should understand what we were doing wrong and what we were doing wrong, not in terms of biosafety, but in terms of internal organization, because we have 2 different clinics and with the 15 people inside, and so being most time of the year, every weekend abroad, this was taking away us time to better organize our team at home. So we took this lockdown to improve this kind of organization, to master and promote and be ready for the recovery. We didn't leave them alone, let's say like this.
To say like that, sometimes it's good to come this kind of period. Look, I have time from this interview. You have time to stay with your family and your team.
Exactly.
Okay. Let's see the best part of this pandemic. Tell me a few words about your family.
Okay, so as I told you, I work with my brother, so I have at least one brother, but actually we are like 4, so 3 brothers and 1 sister, and I'm the youngest one, so my brother is 16 years older than me, so I'm like kind of a solo child because I have a lot of difference between me and them. But working wise, I think that I could not work with any other person rather than my brother, because we engage a lot in terms of like behavior, character, and also I think we complete each other in several things that we are doing. In the meantime, you see the assistants that are passing in the back. So yes, we are at the office. And then what? Personally, I married last year in May, so I also have done the lockdown.
You celebrate
in lockdown, and but it was good. So I saved money because I couldn't go anywhere. I couldn't do any gift. Everything was closed, so that saved me quite a bit.
Yeah, and, but now are open everything, no?
Yes, but the anniversary is past, so next year. I have to work. It was like tough, and I have two children. One son, Francesco, which is 5 years old, and a small daughter that just born recently, the 27th of March, so in the middle of the lockdown. So for me, the lockdown was a moment that I will never forget, but for the good reason, not for the bad reason. My daughter, Viola, came to life the 27th of March, really in the middle of the pandemic situation. So I used April to cuddle her and to stay with my family. So that was a very positive period.
Nice, beautiful, beautiful. It's amazing. You have this kind of, okay, it's hard period, but in the same time, a lot of beautiful things happen. You tell me you are the last, to see like that, the smallest child. How you are? You are spoiled by your brothers? You are a good one?
But you know, as I was mentioning, we have like big differences. So it's not that I'm spoiled. I mean, but of course I'm the smallest one. So I am the one that I arrive at the end of the story, or at the end of my itinerary. So especially with Alessandro, which is the one that I spend the most of the time, I try to listen to his advice, because he had already his life and so he knows what kind of mistakes is possible to be done. So when he speaks to me, I listen a lot, because at the end he's right. So
you are very lucky.
Yeah, absolutely, and that's it.
And where do you spend your childhood? Where you stay all the time in Modena?
Yeah, all the time in Modena. But I was also in that case lucky, because since I was like 11 or 12, my parents were sending me quite often abroad to improve English. So I went several times to UK. I went several times to do that exchange tours on family or in the university campus, both in UK. I did one month in Canada. I did like several months in US. So I was lucky. So I improved my English, and now I can speak, I think, good English. And also I always loved to travel, because we always traveled quite a bit also when I was young. And so while we are traveling for work, my brother and myself, it's something that I like a lot. I like to travel, and this, in fact, I miss traveling, even if for like just 3 or 4 days, going New York, or say, or US, 3 or 4 days. That for somebody thinks that I'm crazy, but I relax a lot in the plane. It's something that, you know, you can plug off and switch off and recharge yourself watching a movie, and nobody's bothering you. Even if there is the Wi-Fi in the plane, I don't use it. So nobody's writing me, no emails, nothing else. So
it's your time with you.
Exactly. And I'm missing it a lot.
Please tell me, when you was a child, if you remind something, crazy thing, what you do and your parents frozen or something.
A lot. But let's say it's not crazy, but I mean, it's now that my son has the same age as me when it happened, I felt into an empty swimming pool. Because I was like walking around the pool, and my parents were keeping saying to me, don't do that, 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 until I felt. And so basically I had like 5 stitches, and I still remember the moment I fell down, because I still remember that. And so that was a good one that I've done.
I understand you. About the dentistry, when you was in the school, what to do, what the school age, what do you want to become?
Let's say that when I was in school, I was not like a great student. I mean, I never liked to study that much. But then when I was at the year previous starting the university, in Italy, I don't know about Romania, but in Italy we have like a test, an admission test to join medicine and dentistry, which are 2 separate universities. And honestly, I wanted to join medicine. So I've studied hard to join medicine. And since the test is the same in the sense that it was structured the same, but in 2 different days, my parents advised me to take both. Take both and see, maybe you enter in dentistry and then you don't enter in medicine, or vice versa, and then you can switch the year after. And but luckily I managed to be admitted in dentistry and not medicine, because I wanted to do medicine because I was watching a TV series like ER. When I was like 18, there was ER, so I liked a lot that TV series, and so this was the reason why I wanted to do the doctor. But luckily I was able to enter not in medicine but in dentistry, so that was good.
How was first year in your dental medicine school? How was the period? I don't know how it's in Italy, but in Romania, first 2 years are clinical medicine. It's like a general medicine. It's not like dentistry.
It was tough. It was tough because, as I said, I like to do more practical things, or like things that I can apply my mind, instead of only like study, like for example, chemistry, for example, was a total disaster. It took me like 8 times to do the exam, and actually I've done it 7 times, and then I said, you know what, I'm doing it at the very end, because I was lucky that at that time it was possible. Chemistry and biochemistry were the only 2 exams that for example, biochemistry was not possible to be done if you didn't do chemistry. But this was the only mandatory step that you had to do. The others was fine. So after the 7th time that I was kicked out from the room, I said, you know what? I'll be back when everything is done. And this is what I've done. I came back at the very end with all my exams done, and the professor, there was a female, she looked at me and she said, finally you're back. And I was like, yeah, I'm back. So now you can cut me every time you want.
Okay. How many years is the university, dentistry university in the Italy?
Give me, can I, sorry, I didn't understand that.
Yeah, I see you're with some people there. It's no problem. It's a live chat. How many years you study dentistry? How many years you study in Italy dentistry school? It's 5 years, 6 years?
5 years back then, now it's 6.
Okay. And you finish your dentistry school and you go to work with your brother directly, or what are you doing?
Yes, while I was doing the university, I started to come here to the office, and then I finished. I did 1 year of working here, and then I went to New York. So it was like...
Yeah, it's one of my dreams. How is it in New York? What is the difference between Europe and New York? How you see the school and dentistry?
Very practical, very practical. You get to see many different patients, and that was good because you also can speak with other people from other countries, and so this is opening your mind, and so you can see what is dentistry about in different countries, and so you understand and you take the best out of everyone, and you improve yourself also just culturally, you improve yourself. So.
And you studied there 2 years?
2 years, yes, 2 years and a half.
2 years and a half. And after you come back, and when you decide to have all this project, because we use on the same hashtag on Facebook, hashtag Dedere.
Funny.
I am happy.
2014, we published the book with Quintessence, which is called Digital Dental Revolution. And so since the foreword was done by Team Atlanta and Team New York, so by the Salama brothers and Dennis Tarn and Steve Chu, I received the foreword from Steve Chu, which was writing. He wrote me. He wrote me. This is the DDR forward, and so from there I picked the DDR hashtag, and it becomes our brand and our educational brand.
Yeah, and you find me in Romania with the same hashtag because all my cars are DDR.
Not bad.
Tell me more about your project, because I know you are involved in a lot of projects, and you make a lot of lecture, and you travel all the world and so on. Tell me
we created this brand from the book, and little by little it improved. It improved because we were, thanks to the book, lecturing more and more. So we were starting to be busier and busier. And after that, we started to say, I'm sorry, we're not available. We can come, or it was impossible to follow both the office and the travel. So we said, instead of like saying no to the invitation, why we should create a team with our friend. We had like many friends and colleagues that we were working with. One of them is Simone. So we have 3 lab technicians, and one is Luca Dondi, one is Simone Maffei, and the other one is Ivo Siginolfi, that are also our lab technician that we are co-working with. And then we had like a few clinicians such as Federico Boni or Roberto Boni, which is the youngster of the group, but also some colleagues of mine from Paris, Leon Pariente, which was with me in New York, his good friend and mate Karim Dada as well, which was another great add to the team. Dr. Ioana Datcu, which is Romanian, but is Romanian but Italian. So her origin are Romanian, but she lives in Italy, and she was my classmate at the university. And so we created this team in where we are sharing information on digital dentistry. And then when we got we got invited in some places, then one person cannot go. We say, okay, listen, we can come, but we have Ioana, which is very good, and the presentation looks like our presentation. He has great material. And so we created this group together, which we are doing also live courses or courses here in Italy, because we have a training center in Sassuolo, which is 5 minutes from Maranello, which is where the Ferrari factory is. And so we were used to do, but hopefully we can do them again, many international trainings with colleagues from all over the places. Really, we had from Colombia to Hong Kong to China, wherever they were coming from, wherever. And the first day, it's a 3 days program. The first day they go straight to the Ferrari factory. They do Ferrari museum, simulator. We eat at the Ferrari restaurant. And then on Friday, Saturday, we do our course. But we start with the right foot, because they are already happy about that. So then on Friday and Saturday, we do the course. And it's nice because it comes, we created good relationship, because we have an internal caterer in our training center, so we can cuddle the attendings. we do like 3 dinners. One is it's a pizza place. One is the Ferrari restaurant. One is the Pavarotti restaurant, because Modena is also famous because it's the Pavarotti town. So we like to organize courses which are an experience. So because in 10 years from now, they will not remember what they learn or what they see or what they saw in the lecture, but they will remember we have been to the Pavarotti's restaurant eating with in his house, or we went to the Ferrari museum. We drive a Ferrari, or because we give them a gadget when they arrive in the hotel. There is a Ferrari gadget, and so I mean there are small details that make the difference, and so this is the reason why everybody wanted to come. And so thanks to this team, we created many projects, online and in person. In person, I've just told you about. Online, together with Dental XP, which we are very close with, we created and we launched a digital dentistry fellowship online. So for everybody that wants to take an online certification with the American university, they have only to go on Dental XP and take this 70 hours fellowship, in where we incorporated Christian Kochman, Nazari, Miguel Stanley, Dean Vafiadis, the Salama brothers, our team, Luis Bessa, all people and all lecturers that Scott Gans, which are involved on digital dentistry. So it's 70 hours divided into 7 modules, starting from why going digital, and then we have like a sort of recipe, you know, besides why go digital and materials. Then we have like how to do the DSD, how to do virtual computer guided surgery, how to do rehabilitation on teeth and implant utilizing intraoral scanners. So this is what we have done so far, and we are planning to do more. But
we talk later.
Yeah,
yes,
exactly. Exactly.
You embrace a lot of digital dentistry. What you made to do it? Because most of the people and most of the doctors after 40, maybe 50, they are not so open to digital. They say, okay, it's the future, but it's not mine. It's the young people future, because I prefer to work analog, to stay near to the patient, and so on. Tell me what made you to decide to go so much in this digital dentistry, because this is your brand now.
Yeah. First of all, we should say one thing. Okay, digital dentistry, it's a working tool. I mean, the basic fundamentals of dentistry, they are here to stay. So we need to we should have our traditional knowledge to start with. Digital dentistry comes after and is a tool. And in these 10 years, we have been able to see that utilizing technologies and materials together, monolithic materials, for example, we were able to be more efficient. We were able to be more efficient because with one single scan, we can go from the impression day to the final restoration in one single shot. And so we were reducing the appointments, the number of appointments for our patients, which means more efficient, which means more free space in our schedules, which means that we were able to better organize the office and our traveling and our educational traveling. But right now, I think that, and at the beginning, intraoral scanners was born just for to replace traditional impression. Right now, it's completely different. We had so much updates, 3Shape, iTero, just to name 2 of intraoral scanners, they became versatile, because we know that now the accuracy is there. But now a scanner like 3Shape, a scanner like iTero became versatile. So it offers us possibilities in terms of like motivational reason, communication with our patient, so we can encourage our patient to accept a treatment plan that before they were not understanding. They were not accepting because they were not understanding. Now they see And so that when they see, they believe. Think about iTero. Now they have the Diagnocam. The Neri technology is the Diagnocam incorporated. I'm not saying that they have a better Diagnocam incorporated. They have a Diagnocam incorporated. So with one scan, I have also the Diagnocam. With one scan, I can explain to the patient and do a sort of ortho simulation to explain how aligners can improve their smile, how aligners can straighten their teeth with the same scan. So this is very important for me. In our hygienist department, we do have one iTero which is working full time, and every patient gets scanned, because we have also opportunity to overlap the different scan. And so we have opportunity to quality control over time. And a patient that does not accept ortho treatment now, in 3 years from now, we can show it to him. Listen, you didn't accept it. Look how the teeth, the crowding worsen it. Maybe it's time to do something. And maybe in 3 years from now, the guy will accept it. You know?
Yes,
it's a very positive working tool. And I think that especially now, we should think about it. Because post-COVID, the biosafety mindset has changed. And how many steps with the traditional impression? How many time the impression gets touched by our hands, by our lab technician hands, by the carrier between the lab and the clinics? And what about shortening these steps? With one click, you have your impression, which is sterile. At least the cloud is still sterile at now. And yes. And they do a digital elaboration, and they do a production with the cam. And so the biosafety mindset right now plays an important role to our patient. And so maybe it's the moment to invest on digital, because first of all, it's going to be the future. But I understand these doctors that at 50 they say this is for young. But now we had a tsunami that changed completely the way we were used to be. So maybe now patient, and this is what we have been seeing in the last month that we have working, they are more keen on biosafety. If we can make a percentage before, standardization, communication, and biosafety were 3 good strategies for our offices, and communication was 70-65%, biosafety was 5 to 10%, and standardization was the rest, 25%. But right now, we have been experienced that people ask why they have to wear a hat, gloves. And so the biosafety percentage is at least at 20%. Less communication, even if it's important to communicate that for example, with the intraoral scanner, we are changing and reducing the cross-infection risks. And standardization, of course, stays still relevant at 30%. So let's say 50, 30, 20, but biosafety from 5, switch it to 20. And an intraoral scanner can communicate to your patient the biosafety mindset. So that's another way of embrace digital dentistry.
How many years do you think will last this transition from analog to digital? When it will be, I don't know, maybe dentistry will be 90% digital. We talk about Europe and not, I don't know, Africa or something.
Okay. I do, because we have several lectures on this topic, so I have also some numbers that I can share. Let's say, for example, that in Italy right now, 1/3 of the lab technicians, they do have a scanner, a lab scanner, and which it's a good number, because for sure there is not 1/3 in the world that have an intraoral scanner, because 15% it's the clinician which own an intraoral scanner in Italy. 33% is the percentage that the lab technician owns a lab scanner. So it's almost double. Plus, we do have 1/3 of these 33% of lab technicians that they do have a milling machine, their own milling machine in lab. So their evolution is there and is not possible to change it. It's an irreversible digital mutation. Okay. Then we have also this number. Over the 50% of lab technicians in Italy are over 50. Okay. So in a while, they will go and enjoy their savings at the Bahamas. And they are entering the new generation of people which is digital native. And so most probably the tendency will be to go digital. In it, and clinician-wise, same thing. We have 20,000 dentists which are going to retire in the next 5 years in Italy. And we have 8,000 to 10,000 dentists which are going to become dentists because they are in the university. And also these 8,000 to 10,000 people are all digital minded. So the tendency is that, and I think in 5 to 10 years, the digitalization will be complete. Because also think about the iPhone. Do you remember when the first iPhone came out?
Yeah. I think I was one of the buyers because I don't have iPhone 1.
If I remember well, it's 2009.
I don't think I have iPhone 1, but I am sure I have iPhone from iPhone 3, I think. And after that, I don't give up. I don't change my phone. I spend a lot of money from this kind of gadget.
Yeah, I have it as well. But if I remember, it was 2009. Okay, and it was already like it seemed like an incredible paradigm shift. In 10 years, look now what they have done. In 10 years now, we have a tool which is completely different from the one that we have first utilized. The software improved, the hardware improved, and now we are able to do many different things. And I think the same will happen faster in dentistry, because now, and probably this COVID situation can speed up the process. Now really digital can be the key for many different things. It's not just an impression, it's also an impression, but it's many other different things.
Somehow,
so let's say, to answer your question, 5 to 10 years, the digitalization will be completed.
Somehow you tell me if in 5 or 10 years you don't change, you'll remain like Kodak, maybe Nokia, because before iPhone start, Nokia was really big company and Kodak the same.
Exactly.
But
that's my opinion. But this was the same thing that it was said 5 years ago, 2015, when all in IDS, all the intraoral scanner came out. We said, okay, in 5 years there's going to be the digitalization, but it didn't happen. But we improved a lot. The updates are incredible in 5 years, and also the percentage, the numbers are increasing. In Italy, 70% of the cases done in a lab are done digitally. 70. In 2015 was 33. So almost double.
Yes, the software become better and better, and the price get down. Because if I remember, in 2008, I wanted to buy a CAD/CAM machine, and cost was like 280,000 euro, a lot of money in the Kjoln, but it was like half of the room. It was amazing. And nowadays, think about, with a small CAD/CAM machine, it's 10 times cheaper, and it's half of the bench. It's something what's happened in this domain. It's crazy, and only in 10 years. I really don't know what to imagine what will happen in the next years, in next 10 years, because if you look back 10 years ago, it's something amazing what is happening.
Yeah, this is what I'm saying. So we have a bright future ahead, hopefully.
You tell me a lot of really good dental technician. Please tell me, what is your recipe, secret recipe to have a really good collaboration between dental clinics and dental technician?
First of all, you must be friend, and you should have, in my opinion, a relationship outside of the work. That's my opinion. And we work with 3 to 4 different technicians here in Italy, and probably work-wise this is good because they are always on the edge, you know, they never relax, so they always there that they want to improve. And then sharing information from the very beginning, it's important. We do have like one chat on WhatsApp with each of them, so we can control the organization of the patients, we can discuss about it. So we are utilizing digitalization also for that.
What kind of information you send to one patient? If you have, I don't know, monolithic zirconia or maybe a ceramic, feldspathic, what kind of information you send it to your dental technician?
First of all, we write to them that we have sent the file, because sometimes without the prescription, because it's a digital prescription, sometimes the file, maybe I made a mistake, I didn't send it right. So I said, can you please double check if you have received this, and this that we have done yesterday? And then we took an image with the iPhone, we took the color, the shade, and we send it to them. Then of course we have also Carteîn, for example, the new 3700 that you can do the shade report. So we ask them if they have seen the shade report, and then we take pictures and we share it with them. And this is basically what we are doing for simple cases. Then while the case becomes more complicated, there are some times in where we go there, because it's important also to go to the lab technician to learn and to see the preparation and to see the cases complexity or cases variables that probably inside of the mouth you were not able to see. And also they come here to get to know the patient, to see it live and to discuss. So it's very important to have like a positive relationship with your lab. I mean, and not exclusive. I mean, we always been very inclusive in our team, and so sharing for me and for us, and this comes from Alessandro once again, being inclusive, it's the key to succeed. And we are lucky that also with Team Atlanta we have a good relationship, and they made it as a motto, you know, always inclusive, never exclusive. But this is a great thing to keep in mind, but not only working wise, also in real life. I've been like this all my life, so I always had a lot of different people that I put together because I like to have them all. So I made a lot of friends that I have now are friends because of me. So
I understand you. You don't. What I understand, you don't take an analog impression. You take on the digital one, huh?
It's very difficult. That let's say 95% of the time digital. But then there are still several cases, for example, full arch on implants. We are testing, we are doing both ways because still it's not 100% predictable. And so there are many different variables. I'm not gonna enter into this right now, but there are many different variables, such as, for example, the scan bodies that still we need to address. And also removable dentures or removable prostheses. In our end, still we are doing analogic workflow, but 95% of the other cases is completely digital.
What I want to ask you, but I want to be 2 questions, because I want to tell me some really impressive feedback you received from your lecture, but in the same time I want another feedback to impress you from your dental clinic.
From the clinic, okay. Maybe what? Can you repeat me the question that I didn't understand?
Some patient who impress you, who give you a feedback after you make an work with him, you make him smiling, And he give you a really nice feedback, and you remind us, say, okay, I am happy I'm dentist. I'm happy I can make people to feel like that.
But
I don't
there
know
is
if you remind
the wife of a friend of mine, of a very good friend of mine, which was one of my best friend and is the witness of also of my wedding. He has this wife, which is a beautiful wife, but she had some issue with her teeth. And so now I see them like once a week, and so every time I see them, they are like saying, we are very happy with what Alessandro and you have done. And Simone was the lab technician, and it's a case that is going to be published soon in the International Journal of Aesthetic Dentistry at the end of this year. So in the last series of the Journal of the Aesthetic Dentistry. And so that's for sure a good result. And I have another friends of her that is treated right now, and so she's wearing aligners right now. But in September we're going to start the restorative part, and so also that it's important because the positive referrals are always like nice. And because she came asking, I want the same teeth of Alex. So we had to stick with Simone. I can't change the application in this case.
Good. Simone charge you more or the same price?
No. Simone charge the same price.
It's a good technician, good people.
Yes, and in the lecture, what I like, it's the teaching person lecture. I mean, I like to, to establish a relationship with the people that I meet around what I do and what I have always done. But I think you remember it. When somebody comes to us, I always give them my business card, and I want their business card. First of all, because I have a collection of business cards with all the people that I've met. But also because I like that when I come back, the Monday morning, the very first thing that we do in the office when we come back from traveling is to send an email to all the people that we have met in order to be in touch with them. Now we have Facebook, of course. We have a Facebook page, which is Studio Agnini #Digital Dental Revolution, that everybody can join and send us messages. But, this is what I like the most. I mean, this is what I see they like, that we are very open-minded, we are very friendly, and so it's nice to see people around that you don't see for a while, and then you get to see them again. So that's the most interesting part, more than wow, your lecture is amazing. I prefer to have this kind of relationship.
You are very busy, and I really want to know your schedule. But like yesterday, what was your program, normal program?
Yesterday was a crazy program. You don't want to know.
No, you must tell us. What means? Because, when I talk with Simone, I admire him because he has always 2 hours in the 2 hours break. Always in the middle of the day. He go to cycling, he go to... what is your program? It's the same, all Italian?
No. If I go cycling, I die, first of all, so I don't go cycling. But besides jokes, a schedule, the office is from 8:45 to 5, full time, so there is no lunch break. We eat in between patients. And yesterday, for example, we had one webinar from 5 to 6 with an implant company to train the reps. Then, so we had a question. We were in the Sassuolo office, so from 5 to 6 was the lecture, and then few Q&A. So I finished at 6:25. I left the office. I ran home because at 7 I had another webinar live that was starting live at 7. In a sort of what you're doing, a sort of interview format like we are doing right now. And so I finished 8:30, but at least I was already home. So my wife was happy. At least I was there. I was not just an image in the computer. And this was yesterday. But usually from Monday to Thursday, we work from 9 to 5 and full time. then Thursday afternoon we go to the airport, and we go depending on when we are going, because when we're going overseas or Asia, we try to compact the commitment, and we stay out 7 to 10 days, and we do one trip. That's it.
Okay, besides of being dentist, what are your passion? I understand you don't like to cycling, but still.
No, but I like sport. I like sport a lot. I like competition a lot. I always did like soccer. I always play soccer. I always play tennis since I was very young. And so right now I'm very much into paddle. I don't know if in Romania it's trendy now, but now in Italy it's trendy to play paddle, which is a sort of tennis. And so now I play a lot of paddle with my friends, because it's a way of seeing my friends in such a way. And then I like more and more to spend time with my family. You know, when I was 10 years ago, I was really a party animal, if you can say like this. I very much like to go out, and I was like, was a crazy schedule under a different perspective. Now I really like to enjoy to spend time with my family, with my wife, with my children, relax, going to the beach, enjoy my son, enjoy my wife. And so this is what I like to do, because at the end of the day, it doesn't I mean, we have 24 hours in a day, so I cannot do anything more.
Okay. What plan do you have for the future?
For the future, we utilize the lockdown also to work on the second book. So next year in May, if everything goes the way we would like they are going, we are publishing the second book, which of course on digital dentistry, and it's going to be a sort of evolution of the first one. The first one was more like why digital is important. The second one is going to be more like how is digital now, and recipes, step by steps, how to do this kind of case, and there is the case from A to Z, how to do this kind of case step by step from A to Z. So this is the future project that we have. I would like, but I don't know, this probably will remain a dream rather than a project, to organize sooner or later our first DDR Education Congress. But I don't know if this will be possible or not, but this is something that I would like to do, maybe inside the Ferrari factory, but I have to become very good in getting sponsors, because there is a brand new auditorium which is very nice, but it costs a lot of money. So, and then I have to also manage to get people in. So it's something that I don't know, you probably know better than me how hard it is to organize a congress. So, but this would be one of my dream rather than a project. But if I see an opening, I do it for sure. Okay, please don't forget to invite me to your congress.
No, because I'll become for free only to see the Ferrari auditorium. Okay, you are staying and you live and born in the Ferrari city. What car you have? What car you drive? BMW. Oh no. It's impossible. I don't understand why people from Modena don't buy Ferrari, don't buy Maserati.
I have to organize. No, my brother has a Maserati, but I do have a BMW, and I have to do many different congress to then be able to buy a Ferrari. Once I organize 5 or 6, maybe I can buy a tire of the Ferrari.
I understand, but you know, you'll have the second book next year on Dental Future in Romania, in Iași. You can sell the book, and with the money you take from the books, you buy a Ferrari. Let's try it.
Yeah. First, I have to give it to the wife. Then, what is left, I take the Ferrari.
Yeah, with the rest, you buy a Ferrari. It's not a problem. It's a small Ferrari in the gas station.
Yes.
A gadget, I think. Andrea, thank you for you accept my invitation. It's more or less 6 o'clock. We are entering the live before we know it. And
thanks. It was a pleasure. And maybe next time my brother can join. I'm sorry he couldn't join, but he might join.
We have I have something in common with your brother. We have the same car. I am sure we will understand. We'll understand him. Please tell me something. I don't know if I don't want to sound something motivational, but you know, dentistry at that period, I are not in the best mood. To the end, please tell me something. I don't know who inspired them or who inspired positive. Yes.
But to inspire, I mean, it's too much. But I can just tell what we have told to our team. I mean, of course, we have been challenged by this situation, and we have two ways of react: or like desperate ourselves and just waiting for the wave to pass and see what's going on, or to stay positive and try to get the best out of this situation. So to improve protocols, to change our things that we were not doing good, to try to get like to enjoy more our family. So don't think that we were always telling them, you're not on vacation. Remember, you just have to take your time for the family, take your time for the office. So your brain always is active. And what I've seen in this first month of reopening here, it was positive. It was great. I have to say, it was really great. It was really great. Absolutely.
I was
the team react very nicely. Now I think also the environment. I was speaking today with one of the secretary, because Monday we have the reunion, because we gave them a 4 weeks execution plan. So Monday we have this summary of these 4 weeks. They are very positive on that. Of course, there is still something to improve, something to do better. But beside, if we compare the before and after COVID, this recover period, which probably will last till the end of the year, started with the right foot, and hopefully in 2021 in January we are ready to a new normal, because I'm sure that we will be able to travel again. And I mean, I'm being positive. Then we'll see what happens. And there's nothing else we cannot do. I mean, being positive or being negative, we don't change. I mean, I can be positive, but if coronavirus comes back, it comes back. If I'm negative, coronavirus disappears, but I'm still negative, so I live worse. So at least let's live, try to get the best out of this and move forward.
Somehow the same thing I feel here in Romania. We are open from only 2 weeks. But if we start with 30% of the work, I see in the last day the recover, and we receive in the lab a lot of impression. In clinics, people start to go to the doctors, and I think it's a good way, because in 2-3 weeks, I think things will become a little bit more normal than it was. Thank you again for the invitation. Please don't close and don't go. Still a little bit 2 minutes with me. I want to announce next week I will have a Romanian dentist, Cătălin Balog-Belo from Cluj, and he will be my guest for next week. Thank you, Andrea, and thank you. Accept my invitation, and thank you the guys on Facebook who was live with us. I think he was good live. He learned a lot of information, and see you next week. Thank you.